Hello everyone, this is Dr. Bill Rawls. The question, can Lyme disease affect your heart? The answer is it most certainly can, and it does. I think most everyone has some cardiac symptoms, either skipped beats or just flutters of the heart or feeling uncomfortable. Now, some of that is just from the sympathetic overactivity, the overactive fight or flight response that occurs from just the stress of chronic Lyme disease. But I don't think there's much doubt that these microbes can affect the heart directly. Not only Borrelia, but the co-infections. So Borrelia, what this microbe wants is collagen. That's a resource that it needs to survive. So that's one of the things that it's looking for in the body. So muscle, brain, skin, these are areas where you find Borrelia. So it is well known that Borrelia can be present in the heart muscle and can cause inflammation in the heart muscle. Other co-infections like Babesia, Bartonella. Now these infections, Bartonella especially, is notorious for affecting the lining of blood vessels. So you can find that Bartonella is affecting cardiac vessels and all the blood vessels in the body. Mycoplasma and chlamydia have been found in vegetations on heart valves. So there are a lot of ways that these microbes can affect the heart. Now, typically in a healthy person, like you can have Borrelia, Mycoplasma, all of these different microbes and not have any symptoms at all. So if your immune system has taken a tumble for whatever reason, these things flourish, and so they are present in tissues, and when they start to flourish, they start causing symptoms. That's one of the things that actually led me to find that I had Lyme disease. My heart was skipping every second to third beat. My heart rate was lower than it should be. I was having continuous chest pain, exercise intolerance, and a little bit of shortness of breath. I went to the cardiologist. I ended up having a cardiac cath. They found that my heart vessels were clear, so the most they could offer me was a beta blocker. I got frustrated after that point, and it was shortly after that I found that I had Lyme disease and started treating it very intensely with herbal therapy. So I treated it with all the antimicrobial and immune modulating herbs that you've probably heard me talk about: andrographis, cat's claw, sarsaparilla, Japanese knotweed. Japanese knotweed, especially the resveratrol, has some really nice properties for the heart. The reishi mushroom, cordyceps, all these immune balancing adaptogens are really, really good for the heart. So what they're doing is suppressing the microbes, but they're also helping oxygenate tissues, helping the heart work better. But on top of those, I also use Hawthorne. Hawthorne is a really nice herb, and I was taking about 1,200 milligrams of the standardized extract, sometimes twice a day. And what Hawthorne does is it helps the rhythm of the heart work better. It helps the heart contract better. It dilates blood vessels so you get better blood flow. So Hawthorne is considered a heart tonic. So those things are really important. So if you have chronic Lyme disease and you're having symptoms that are significant. Now, everybody has some mild flutters, a skip beat every now and then. So I would just put those as regular symptoms of chronic Lyme disease. May or may not be related to significant invasion of microbes in the heart. But if you've got significant skip beats, a lowered heartbeat, which would be a sign of a heart block, chest pain, shortness of breath, exercise intolerance, with your heart rate being affected, that's something that you really should see a cardiologist for. If they recommend a cardiac cath or any other kind of cardiac evaluation, go through with what they recommend, because first of all, you want to make sure that it's not something else like a blocked heart blood vessel, a blocked coronary vessel that can end up being a heart attack. So it's really important to have a thorough evaluation by the cardiologist, but they're going to be somewhat limited in what they can offer. Beta blockers can sometimes help regulate the heartbeat. I personally found that they had side effects that I didn't care for. I didn't use them. Ultimately, I found that the Hawthorne did a better job for me, but some people will find that the beta blockers work very well, and that is certainly one option. So take what the cardiologist and your physician have to offer. Use good judgment in using those things to your benefit, but don't stop there. I think the herbal therapy is really important for restoring function back to normal and finally getting a handle on things. But cardiac symptoms are serious. They do, you definitely need to be evaluated. You definitely need ongoing attention until those symptoms start to resolve. Don't let them go too long. Sometimes you do need aggressive antibiotic therapy, but it's definitely something that the herbs can help with, whether you use antibiotics, whether you use beta blockers or any other recommendations. Do the herbal therapy, because in my opinion, that's ultimately going to get you where you need to be, which is ultimately a symptom-free state. Now at age 61, I really don't have any cardiac symptoms at all. I think my cardiac health is actually quite good along with the rest of my health. It took a while though. It took me several years before all the skip beats went away and my heart functions came back to normal. If you found this information valuable, please check out my website, Rawls MD. I wrote a book called Unlocking Lyme. It's got a lot of good, very valuable information about cardiac type symptoms. And sign up for our newsletter. Be sure and watch out for new videos coming out, and see you in the next one. Take care. Thanks for watching this video. Please take the time to leave a comment below. And while you're there, ask me any questions, or if you have topics that you'd like to hear about, pass those along. And please subscribe to my channel so you'll have these videos coming your way regularly. Thank you.